Okay, so let's start now an amazing podcast here with my great friend, Edgar Kaminskyi. Thank you, my friend. And also I'm here with Eiki.
Hey, thank you so much.
It's
Olá, sou Alessandro Martins e seja bem-vindo ao nosso Deepcast 2024. Aqui você encontrará as principais discussões sobre cirurgias da face com alguns dos cirurgiões mais renomados do mundo. Inscreva-se em nosso canal e fique por dentro.
Let's do it. Let's make it.
So, Edgar, probably you already know, he's one of the top surgeons in the world. He was in Ukraine and now he's in Italy, right? And let's talk a little bit about general things, okay, Edgar? So tell me, how is it now? You started from the beginning, right? In Italy, how is that new journey for you there?
I will explain you.
Yeah.
Which phone do you use?
iPhone.
iPhone. Okay. So imagine that you use iPhone, and now you will use, I don't know, Android phone, Samsung, or before it was Samsung, now iPhone. But you don't have previous passwords and logins. Your phone is another language.
Wow.
Another applications. So it seems like you're doing the same things. You send the messages, maybe you make the photo, but it's quite different, and you need time, yes, to be prepared for all of these things. So it seems like the same, but it's quite different, and especially if you are talking about surgical life, because for now, I can compare, because when you're working with your anesthesiologist,
Yeah.
with your nurse, everything is fast, everything is predictable. So you just put your hand, your nurse give you the right instrument, everything is fast. It's like a pit stop.
Yeah.
So you come with your car, they change the wheels and you run. Now in Italy, okay, how do you want to change? Which wheels? Do you want something else? Yeah, no, like this. So, yeah, I cannot say that it's difficult. It's interesting. It's not comfortable. Because, of course, when you didn't have nothing and you move somewhere and you start from zero before you had nothing, okay. Yeah, but if you had before everything,
You had
everything, like everyone knows in your country, you know everyone. If you have any problem, you can call.
Yeah.
And now everything is gone and you start your new life. So it's like this.
Yeah.
So, Dr. Edgar, so let me understand your background if you want to share with us. Did you do all your training or your graduation in Ukraine? And this time that you are living and working outside Ukraine in Italy, that's the first time that you are working outside of your country?
Yes, I was graduated in Ukraine in 2008. So it was a long time ago. I started as ENT, then plastic surgery and general surgery. At that time, the education was like this. Now it changed. So general, and then you can choose plastic, ENT, boom, 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 like that. And I started my private practice when I was 27. So before I worked in the public hospital, and then public and private, and then mostly private. So from 27, I started to do rhinoplasties. For the first 5 years, I did only open rhinoplasties. Then I said, okay, I want to change something. I met a lot of famous our colleagues, and it was like challenging for me. I said, okay, I want to do that. And then I met once Drlessandromartins, and he changed my opinion about facelift. So he changed my life.
So tell me a little bit about that. So we know each other for some years. We did some webinars, but on that time you were performing mostly rhinoplasties. And when we were looking to your Instagram, when you were in Ukraine, you were basically doing, if I don't make a mistake, rhinoplasties and breast surgeries.
Yes.
And how you came to this world of facelift, and how is it new journey? Because as you told about your changes from Ukraine to Italy, you're reinventing yourself, right? You're starting from zero and you do things amazingly. So tell me, how is it your new journey?
My most favorite surgery is rhinoplasty. It's my passion. It's yours. But the breast, how I started to do the breast, because I did the noses, and then patient, they once came, oh, but can you do breast? Can you do breast? I said, okay, but after ENT surgeries, from macro surgery, to make the pocket, to insert the implant, it's not so difficult. Of course, every surgery is difficult, but it's not like frenopia. Okay, so I don't do liposuctions, I don't do tummy tuck, no. So face. Also, I was graduated in art school. I like to draw in the portraits, I like to make the photos, like that. So my passion is face. And I'm pretty happy about the rhinoplasty, but of course, people, they start to ask. But before, for example, in my country, I didn't saw such incredible, great results as Brazilian results. Because now, from my opinion, I can tell that there is European results, in European plastic surgery, US plastic surgery, and Brazilian plastic surgery. And what I like in Brazil, because the competition is very high, and the patient, they are so open for the plastic surgery. So you have, I think, the biggest experience in your life, because in other countries, people, they can think, you're afraid of many things, but in the Brazilian guys, they're so well skilled. So I don't know, for example, in that meeting, when all of this Brazilian 300 500 surgeons, they're watching to the surgeon from another country, do they know something new? This is my question. I want to ask for all Brazilian associations. So you're great, you're fantastic. So yes, I started to see that really great results, and it's like, okay, I want to try. But of course, if I can compare, rhinoplasty for myself, it's 100 handmade, and it's all time, every day is the new. Because the face, more or less, has the same anatomy.
Yeah.
You cannot find the jugular vein here, small, bigger. The cartilage is bone. You cannot find the same. You cannot. It's impossible. So this is, for me, is the difference because of that. But because of the artistic work, because of the whole face, yes, of course, it's interesting.
I think this is very interesting because you are very well known for your artistic eyes, your artistic background, and then you mentioned that you were used to draw. I think during high school and during your infancy. But that's a topic that I want to explore more with you, because you're a very artist. So how you already switched the surgery that you were used to do, like rhinoplasty, to do some body case, breast case, and facelift. But tell me, let's talk a little bit more about your job doing illustrations, as we talk, your presentations and all your Instagram are very beautiful. The illustrations about noses and structures of the faces. So how did you learn to doing that? So what were you thinking about to start doing that?
Okay, I will tell you. So first of all, when I was 5 years old, I decided to be a doctor, but I don't have anyone from medical field in my family and from the past. So I'm the first doctor. I don't know why. It was 1990. And then when I was maybe 10 years old, I decided to be a plastic surgeon. But from the 3 years old, I draw. And for example, from the beginning, I was working with the computers, with the first Photoshop. So I work with all of the grades of the Photoshop. So it's like my hobby. So I can use my hobby in my practice. This is the best combination, because, for example, if your hobby is fishing or if your hobby is football, basketball, how you can combine it's difficult. So I'm always with my Mac, I'm always with my iPad. I can draw or I can make the photo and video, combine, boom, and this is the video for the social media. The same, I can sit on my chair and I can starting to make the modeling, I can start to make the drawings. Yes, then I put it to the Instagram, and that's how I work. I never work with the SMM companies, social media companies. Everything that you see on my pages is done by me. So I'm 99% of the content is my content. I do it by myself. There is no person who will answer you on my direct. So if someone answers you, it's me. When I have time for that, this is the question. I think in our life we should make the biggest decision like work or family, because it's really difficult to combine. Yes, we know a lot of books. We can speak with the colleagues that we should find the right combination, but it is difficult. So if your wife will tell you should be at home, what you will say? This is the question. So my goal, I was always looking for the work. I said the work is the most important for me. And my kids, they know that. They know that their father in the Congress, in the meeting, from morning till night, I was always working. I want to show my kids, if you want how to have something in your life, you should work. Yes, we can play basketball, football, other things going Saturday, Sunday, yes, but I'm not from wealthy family. I'm not from rich family, so I'm self-made, so I want to show them, look, this is what you should do nowadays in our life. This is only one chance. When in the future I will be a wealthy person, they can choose to stay with their family, maybe just to have a hobby, not to work, but in my life it's like this. So the combination of art, that's what you like in my social media, and I'm happy that you like it.
Yeah, we love it. Okay, so talking about your lifestyle, I think this is a challenge you said, and many of us will have the same challenge. So how many days a week do you work, and how many months or weeks a year you take a vacation?
So before Italy, during the year I had 2 weeks of vacation, 1 week in January and 1 week in August.
Only that?
Yes.
Not counting meetings, right? Only pure vacation.
Just pure vacation, yes. Okay. Meetings, yes, but also it was not so much few. So we worked from morning till night, Monday and Sunday, also in my clinic. As I can see now in Europe, it's another lifestyle, what the people doing. But in my country, people, they like to work. So Ukrainian nurse will start at 6 a.m. and will finish at 11 p.m.
Really?
And she can do it every day and just will ask you, oh, please, can you give me a few hours on Sunday? I want to see my kids. The Ukrainian people, they really like to work. And for now, I think it was from the past. I'm maybe a little bit stressed with them, but when I'm not doing something. So I cannot just relax and sitting, on the beach and just working. I will listen the podcast. I will listen the audio book. I don't know. I will create the new projects, ideas, the new movies, and I immediately will do that. I never postpone the information that I want to put on the social media. So if I create an idea, create a video, I immediately will do it this evening, and immediately I will post it, I will do it next day, because I know that some people, they have the schedule. Okay, so next day should post this and that, next day this and that, or you have the plan about the stories, about other things. I don't have time for that. So you cannot imagine how many gigabytes of content I have. I just cannot post it. I even don't have time to post my results, because I have different pages for the results, then different pages dedicated to the surgery, to the lifestyle, to the artwork. For now, as I remember, maybe 8 pages on the Instagram.
I know you have a lot.
If combine everything to one, I think I should stream every 30 minutes or 20 minutes, because I like to show what I see, for example, from my camera, or in my videos, or in my photos. But it was from the beginning. Because many people, they want the same, but I think it should be, from inside. So you need to love it, because if you take your phone, it's like, okay, I need to make the video for my story. So it's not like that. It's like to going to the gym. At the beginning, it's painful. Then after 6 months, 1 year, you really like it. You like to run, you like to go into the gym. The same with the social media. I don't think that we really need this. My dream is not to be on the social media. Not to have Instagram account, maybe only for my pictures from my vacations and like that. Not to have Facebook. Maybe for now also my website is only my contacts and my prices. That's it. Because I think the patient usually they are looking for that. They want to know the phone and they need to know the price. That's it. All other information they can ask ChatGPT. They can see the YouTube channels and other things.
And did you feel any difference in the pattern of the patients that you have now in Italy and the patients that you were used to have in Ukraine? So how is going now your practice dealing with because we are now living in another culture, right? I don't know how close culture, Ukraine and Italy. So how is going? Did you feel any difference in that you? Because all these stories that you are sharing with us, you seem to be a very tough guy, that you can do your very work harder, and how you are getting used to this new life and new kind of pattern of patients.
For now, I have 0 Italian patients.
Oh, really?
Yeah, I don't work with Italian patients, and I don't do surgeries, rhinoplasty, breast, faces for Italians. All of my patients are from other countries or areas. Usually it's US, Canada, UK, Spain, Poland, Latvia, Lithuania, Sweden, Dubai. That's the most countries. And the same was in Ukraine. Like 70% of my patients, they came from abroad, from another country. That's why I moved from Ukraine to Italy, because I understand that people, it's impossible to fly now. Yes, most of my friends, all of my colleagues, they are staying in Ukraine. They have a lot of work now, a lot, you cannot imagine. So people, because of the stress situation, other things, they really do plastic surgeries a lot. Also, they cannot travel. You stay in your country. You cannot fly to another countries. Okay, I will do surgery now in my country. So the business is good in plastic surgery. But I moved because I understand that thing. Another thing, yes, I want to try to work in another country. It's like, for example, you like sports?
Yes, I do.
Which kind?
Soccer.
Okay. So imagine that you are playing for Brazilian, yes, a championship, and then like European club in Spain, in UK, in Italy will buy you. I said, okay, I want to try myself in another league. So it's like this.
Yeah.
It's difficult. Okay, but I want to try it.
It's a challenge.
It's a challenge.
So what is the biggest, first, quick question, which is more difficult for you, rhinoplasty or facelifts?
Rhinoplasty, of course.
Yeah.
Right. Not difficult. Okay, rhinoplasty. For now, I cannot say that it's difficult.
Challenge.
But I think it's how we are taking care of our patient. Because I know you, I don't see a lot of your surgeries, but I know how you are working, like very precise, millimeter by millimeter. So that's why rhinoplasty is difficult. Yes, we know fast rhinoplasties, and we can do rhinoplasty for 40 minutes. And for 80% of the people, it's okay. Because for many people, what does it mean, rhinoplasty? Just to rasp the hump, to put some stitches, and it's really nice, okay? And they don't see the differences. Yeah, they don't see the difference. But for us, it's 2 hours, 3 hours of the surgery. That's why rhinoplasty is difficult. Because of course, on face you have much more dangerous structures, for sure. But I think rhinoplasty.
What is the main challenge for you in rhinoplasty and main challenge for you in deep plane facelifts?
I'm always unsatisfied in everything, but in a good way. So I think that we can be better and better. For now, also we can see that anatomy changed. So for 10, 20, 30 years, if we are talking about T-plasty, now we have not the new structures, but another philosophy of the structures. It's okay. Then about the osteotomies. Before it was just osteotomy. And I remember it was 10 years ago, we just discussed which instrument to use. Piezo or classical ostomy. That was. Now you change how you cut the ball.
Yeah.
Banana shape, G shape, round shape, rectangle shape. So this is same. So everything challenging. In the face, the same. Before we talk about SMAS, now we say that SMAS doesn't exist. Okay, doesn't exist. How we need to say this? But I had the company. We are doing 3D videos. So for the beginning, I started to do by myself. Then, of course, it's quite difficult and long work. And now I have people in my team, and they are not doctors. They are engineers, and I train them. And like every week, I send them scientific PDF material and files. So now imagine that just normal person, believe me, knows sometimes much more than many surgeons. For example, about the face anatomy. But their question, we know the Leonardo da Vinci drawings, other artists. So for 600 years, still now we are discussing where's the nerve, where is the ligament, and they ask me, you really don't how you did the surgeries all your life, all these years, but what can I say to the people that we are on the stage, we are talking for 10, 20 years, and for now, yes, but we know that mandibular nerve is going, yes, like now not 6 centimeters, 5 centimeters higher, and the cervical is going to the down. And before you did know that, but how did you do the surgeries? This is this is really, really interesting. And the same. So the 50% of the presentation is anatomy. And for many people, they said, yes, but you should learn it in university, yes?
Yeah. Yeah.
So this is I think everything is challenging.
Yeah. And continue speaking about faces. So which technique did you choose, or do you use the same technique for face? For example, dual plane, deep planes, high mass. Do you use? Did you choose one technique that you apply for like of your patients? And so which technique are you using now and why?
Dedicated to your hybrid technique. I think we also name it hybrid technique. Why? This is technique that release the ligaments. Where you will release the ligament and which ligament, this is the question. Because, of course, if you need to release these ligaments, you should go deeper. So, deeper. If I don't need this area, it means maybe it's not deep. So, it's changed. So, for many techniques that we saw now, what people are doing, they just release everything, and then our body sticks by itself everything. So I think this nowadays is the combination of all techniques. Of course, I think we should know the plane and we should use the plane, but I don't think that's for all of our patients. Yes, but we need to know the anatomy and how to work with the ligaments. This is the most. And of course, we need to know more about the tension. Now, everyone are talking about the crevasse. Maybe after 5 years, we will find another point.
Well, Edgar, I think we're running out of time here, but I would like to thank you so much. I think talking with you, it's much more than understanding about rhinoplasty or facelifts, but also about mindset, because the power to reinvent yourself, change countries, and basically keep on the same level the way we knew you when you were in Ukraine, not level as a surgeon only, but also in your social media, your 3D videos and etc. So it's amazing. So
my example is that you should not be afraid of something in your life, because many patients, they're always afraid. Many doctors, they're afraid, for example, to change the clinic, to change the city. They're afraid to change the price. They're afraid to change the camera. or many things. But at that time, you see a lot of people who change their life completely. So don't be afraid. Just go straight and everything will be fine. Of course, you should find your passion. So my recommendation, it could be music, it could be sport, for example, it could be art. So I like to work to see something beautiful. It can be a museum. In your city, you have nice museums, and of course, with the nice audio, nice music, you cannot imagine how many great ideas you will have here. But another my advice: immediately make them real.
Put in practice.
Yes.
Amazing.
Don't
Sorry.
Dr. Edgar, thank you so much for coming here to Brazil. Thank you so much for having this conversation here and sharing all your story. It's beautiful and it's very inspiring for all of us. So thank you for coming and thank you.
Thank you, my friend.
Thank you.
Great. Very
Wait, you
here.
Okay, thank you.
All right.